name is Jada Okoye, and my research is about evaluating the role of infographics in promoting radiation safety among dental professionals, and I chose this topic based on my extensive research in this area. A little bit about me: I'm a rising senior at Osborne Park High School, and I currently partake in the biomedical science program. In school, I serve as the president of HOSA, and I also serve as a student senator on my county's board. Outside of school, I love working as a pediatric dental assistant. I also run an international medical blog organization, and I am fascinated with research. This summer, I was able to work with the Cancer Society of America to be a research intern. On top of that, I am the vice chair of the events committee with the Northern Virginia Youth Science Center, and I love being one of the founders of STEM Explorers, which is an organization that bridges educational gaps between those that are underdeserved. In the future, I hope to be a pediatric dentist and public health leader, but now let's get into my research. This is the ionizing radiation particle, and to the eye it is very small, but today I'm going to explore with you how something so small can cause an immense amount of damage. So according to the World Health Organization, ionizing radiation is energy that is released by atoms in the form of electromagnetic waves or particles. And this particle has an immense amount of beneficial applications, especially in dentistry. Now, it is primarily used in the role of X-rays, and according to Dr. Sinch, it can be used as a diagnostic imaging to look at the teeth, the jaws, and surrounding structures. And it can also detect dental problems and planning certain treatments for patients. And according to the American Dental Association, over 320 million procedures were done in 2023 alone. Now, even though ionizing radiation is a powerful tool, it can also carry an immense amount of risk. According to Dr. Talapico's study, where he looked at the impact of radiation on individuals, he found four specific things: tissue damage, radiation burns, cancer risk, and cataracts. Further studies also emphasized on the notion of radiation risk. For example, Dr. Huang found a correlation between dental X-ray exposure and brain tumors and thyroid cancers. Dr. Varaneva looked at radiation exposure in local residents, and he found many of them had chromosomal and somatic mutations. And this is especially harmful for adolescents as their cells are very sensitive and still growing. And this is where the ALARA principle comes into play. ALARA stands for as low as reasonably achievable. In dentistry, it is used to minimize radiation exposure to both patients and staff, and it allows diagnostic imaging to be clear, but also keep radiation levels very low. However, there has been a lack of compliance. Studies such as one from Dr. Shahab found that dentists, although they do use safety measures, they did not consistently minimize radiation exposure. On top of this, Dr. Lee and Dr. Ludlow's study found that even though dentists relied on X-rays, they did not discuss radiation risk with patients and inconsistently used protective measures. And this leads to the gap between knowledge and practice. Now, if dentists do know the risk, why don't they always follow the safety measures? This led me to dive deeper to find this conclusion. There is stress in dental offices. Dr. Moran and Dr. Croce found that this stress can lead to a neglection of safety protocols. So this non-compliance does not stem from ignorance, rather it stems from workplace pressure. But this is where public health campaigns come right in. Public health campaigns are organized efforts, and they are designed to educate and influence behaviors to improve health outcomes, and they are very effective tools to raise awareness, as seen by the one by Ohio State University. In terms of global health, healthcare workers' health is a very critical and important public health priority, and visual tools like infographics are very accessible, low cost, and scalable. But the big issue is they're mainly targeted towards patients and not towards occupational workers, which leaves the question: how can we protect healthcare providers while also improving healthcare outcomes? Now, throughout the year, I delved through this question that asked, how do public health campaigns on radiation risk and safety protocols influence dental professionals' perceptions of radiation safety practices in a suburb city in Virginia? To answer this question over a 1-year-long period, I had a target sample size of 80 participants, as there were 50 dental offices in the area, to receive a 95% confidence interval. I recruited these professionals via email and outreach, and to do this, I made a survey that assessed radiation safety knowledge, current safety practices in terms of Virginia, and awareness and behavior of safety campaigns. Now, this is the infographic that I collected in terms of radiographic safety concepts in my state, which is, again, Virginia. Now, there were two experimental groups. One was Group A and one was Group B. Group A read the infographic before taking the survey, while Group B did not. Why did I do this? Well, I wanted to test whether the exposure to the information from the infographic would change awareness and behavior to see that baseline knowledge and attitudes without any interventions. To do this, I had to do a comparative analysis and a t-test. The comparative analysis would see the difference between the two groups, while the t-test would see if that difference was significant. Before I did this, I had to look at knowledge gaps. I needed to assess whether the current level of knowledge among the dental professionals between the two groups were different, such as on radiation safety concepts and awareness of risk, and however, there was a major gap that was found. For example, when I asked professionals, were they aware of what the LAR principle? 72% said they were. However, of that percentage, 61% got the question wrong when I asked them to choose the correct LAR principle. Second, when I asked if they were aware of the potential risk in terms of radiation, 86% said they did, but from that 86, 88% were wrong when I asked them to identify these risks. So clearly, there are health gaps, but now let's see if there is a statistical difference between these two groups. So these are the questions that I selected to analyze, which all looked at attitudes and knowledge in terms of radiation safety. So to do this and to see the two differences, I had to do a t-test. A t-test compares two means to see if these means are significant. If the value is below 0.05, it is significantly different. If it is above, then it is not. Here's a graph looking at my results. As you can see, the questions are on the X and the mean response are on the Y. Depending on the group, the mean responses were very different, but as you can see between A and B, they're very different values. And when I calculated the t-test values, they were all below 0.05. Now, what does this mean? This shows that infographics about radiation risk significantly influence attitudes and behaviors compared to Group A and Group B. As seen from the graph, Group A was more likely to adopt better safety protocols due to their mean values, but this was due to the fact that they had the infographic as their information source. So this means that the infographic also had an impact on participants' awareness, confidence, and intent to adopt safety protocols. So what are the implications of this on a global health scale? Well, radiation safety is not just a dental concern, it's a global occupational health issue. And in terms of many low-income or middle-income countries, our healthcare workers lack access to training materials or continuing education, which connects back to the compliance. But infographics can bridge this gap because not only are they accessible and affordable, but they're also translatable. And they're a very low-cost tool to improve safety in underdeserved communities. So, although infographics can be seen as very simple tools, they can have a very measurable impact on healthcare behavior. And globally, healthcares across the world deserve to know this and deserve to know that there are many better routes to see as better education. So visual tools like these, again, are very low cost, adaptable, and can be rapidly deployed in clinical environments. So I ask you this. In a world of complex health challenges, what if the most effective solutions are those that are the most accessible? And how can we use visuals not just to inform, but to protect, empower, and transform healthcare? Here are my references, and I'd love to thank my AP research teacher, Ms. Waters, and also my mentors along the way. Here's my contact information right here. Thank you so much.